Greetings, everyone. My name is Jason Pogue, and I'm the president of the Society of Infectious Diseases Pharmacists. On behalf of SIDP, I'd like to welcome you to our COVID-19 resources page. Really, the purpose of this introductory video is really just to orient you to what's available on the page. For those of you who have been here before, you'll note that it looks a little bit differently. And that's because as the pandemic has evolved, so has our offerings on this page. When the initial pandemic hit, this website focused on two main things. One, we had members who were going to great lengths at their institutions to develop therapeutic protocols to teach people about the drugs with regards to in vitro activity, with regards to history and other zoonotic coronaviruses, and important pharmacological information. And so what we did is we put together some educational reviews that people could come listen to with that information, so to be able to better educate everybody with regards to COVID-19 therapies. That was one main feature. The second main feature of our website at that time was, if you recall back at this time of the pandemic, there was just a deluge of information coming out, some studies coming out of varying quality looking at different therapeutic options. And it was really too much for frontline clinicians to be able to review all of those publications. So what we did is we used our skills as pharmacists to do thorough literature evaluations and post-journal club reviews. So really our website consisted of those two main things: the therapeutic videos and the journal club reviews. As the pandemic has evolved, so has what we want to provide. A lot of those initial reviews, just getting an in vitro activity, history in MERS, history in using these drugs for SARS, are no longer quite as relevant. And so we really kind of redesigned this page, and my goal here is just to orient you to the four big buckets that you're going to see below you. First and foremost, still the hallmark of this webpage is going to be our COVID-19 therapeutic reviews. What they look like has evolved over time because, again, the data that we have. So there's more of a focus in a lot of these therapies that are becoming used in our patients more commonly in going through the data. So really, in addition to talking about the in vitro activity, now getting into the clinical data, but also still focusing on important pharmacological issues such as mechanism of action, drug interactions, and adverse events. So that remains the focus. You'll see that in the top corner there. And one thing I do want to remind everybody, particularly our pharmacist audience, is that every single one of those is still available for free pharmacy CE. All you have to do is answer a few questions about the material that you reviewed. So that's really the hallmark of this site still. The second thing that you're going to see linked below is our Breakpoints podcast. We will periodically have Breakpoints episodes related to COVID-19 management, whether it's sharing our experience, whether it's literature evaluation, or whether it's something like, let's talk through the remdesivir allocation process. Again, as part of our broader goal of educating through those podcasts, we do have features on COVID-19 as well. So I encourage you to follow along to that link, subscribe to our podcast, come for the COVID-19, but stay for all of the other infectious diseases pharmacotherapy goodies that you'll find in those podcasts. We have over 2,000 subscribers to date. It's very well received. There's practical, important infectious diseases pharmacotherapy information that is given in those podcasts. So that's the second feature of this site. The third feature is external resources to our friends. We're very fortunate at SIDP that we work with a lot of great organizations, other professional organizations, governmental organizations, and really the third bucket of this site is really to link to the key references. Things like the NIH treatment guidelines, the IDSA treatment guidelines, but also key sites like that of the CDC and other important agencies. So again, if you want to see what other organizations are doing, what we think are important resources, we link to that as well. And then the last thing that we have on the site is our historical resources. Again, as I told you, we evolve like this pandemic evolves, right? So what we have to provide on this website also changes. However, we acknowledge that some of those previous resources might still be of value to you. Things like our literature reviews or journal clubs in the past. So we also have a historical resources. We put that there for transparency's sake. And again, we know that they are still valuable to certain people. And so we have that all there. So those are the 4 main features of this site that you're going to find. You also find any position statements that we might make as an organization related to COVID-19. Again, as this pandemic continues to evolve, so will our resources. So one thing I will say is do not hesitate to reach out to us. If there's something you would like to see us be doing, we are open to those suggestions. Our contact information is available below on this site. Again, this service is here to be provided to the general public and to the healthcare community to be able to improve the management of our patients who suffer from this terrible disease that we see spread across the globe. And so with that, I thank you again for visiting our resources, and I hope you find them to be useful.